for joining on the third day on for the Oral Awareness Month, which where ICanCaRe along with the Foundation for Hedonic Oncology, Sterling Cancer Hospital, and Gujarat University, conducting this ICanCaRe second International Oral Cancer E Conclave. So, a very warm welcome to everyone to this third day of scientific session.
Now we are moving forward to the scientific session number 3, which has 3D printing. As a variety of novel technology, 3D printing has been coming up in the field of healthcare, especially in cancer. And in oral oncology, 3D printing can help us enhance dental rehabilitation and maxillofacial reconstruction. To talk more on that, I would like to welcome the chairperson for the session, Dr. Srinivasan sir, who is MDS prosthodontist. He has done his MDS from Government Dental College, Mumbai. He has special interest in head and neck maxillofacial rehabilitation. He has been awarded postgraduate fellowship in maxillofacial prosthodontics from Holland and Sweden, 2006 and 2008. He is also been the recipient of international fellowship from UICC, and he is the current executive committee member of Indian Prosthodontic Society and section editor of various journals. He is also the chief executive of Enhanced Head and Neck Rehabilitation and managing trustee of Enhanced Social Initiative, which has been developed by him to develop prosthetics and affordable and accessible to the nation population. To talk more on the session, I would like to welcome our speaker, Dr. Vani Parmar, madam. She is professor surgical oncology, oncoplastic and reconstructive breast cancer surgeon in Tata Memorial Center, Navi Mumbai. She has been past convener of breast cancer DMG in TMC Mumbai, and she has multiple publications at national and international level. I welcome Dr. Srinivasan sir and Dr. Vani ma'am, and further.
Thank you. Thank you for your kind introduction, and I think without further ado, I'd request Dr. Parmar to carry on with the proceedings. Over to you, ma'am.
Yeah, thank you very much. At the onset, thanks Prathamesh as well as Dr. DeCruz for having suggested my name for this odd topic. And I am the odd man out, or the odd woman out, I should say. A breast surgeon now speaking in a forum filled with head and neck surgeons. So I do feel outnumbered, but I do hope I bring forth something that's interesting. And this is because I have additional interest beyond breast surgery. So I have a topic to talk about, which is completely away from clinical oncology. This is 3D printing, something that has interested me for the last 4 years, and have got into it by taking small baby steps, I would say, because we began in a very small way in ACTREC, and now we have reached a level that I think we can bring it into clinical practice. I have a disclosure, definitely, and the disclosure is I'm a breast oncosurgeon. I don't practice head and neck oncosurgery. I do oncoplastic breast surgery and breast reconstruction, which is where my whole interest in getting into 3D printing came in. And of course, I do have a keen interest in something beyond clinical oncology, where I have projects in 3D printing as well as in AI, artificial intelligence, which is ongoing. And I have no conflict of interest as far as 3D printing is concerned. Well, we do know what is 3D printing. It's additive manufacturing in oncology, where we know that it has helped not only in health industry, but probably in the whole of industry. It has helped in shortening procedures, making technically everything easy, and reproducing of devices, etc. is very easy. But where do we really have a role of 3D printing in oncology is in anatomical trainer models, personalization by devising customized implants and prostheses, medical devices by rapid prototyping and manufacturing, in therapeutics by surgical guides and templates, radiation delivery devices, and of course in various other areas where we have seen in the last 2 years, it has helped us even in the pandemic situation. What are the type of 3D printers? Let's first understand the basics of 3D printing. Other than, of course, the technology where it is an additive manufacturing, 3D printers are various, and they can vary from anything from a simple fused deposition modeling printers, which are easily available off in the market, to very large scale, the powder sintering and powder bed fusion printers, which are really large, they occupy a lot of space, and they are very expensive. But let's understand the basics of 3D printing first. So the printers that we know are, of course, the first, the FDM, or the fused deposition modeling. There is photopolymerization, where we're using stereolithography or direct light processing to create the objects. Polyjet printing, which is also based on the inkjet principle, powder bed fusion, and bioprinting. The various substrates that can be used in 3D printing, most commonly is polylactic acid. Polylactic acid, ABS, and TPU. ABS is acryl nitrile butadiene styrene, and TPU, which is thermoplastic polyurethane. These three are commonly used to create prototypes. They're used to create models, and they have, some of them, especially the ABS and TPU especially, has pliability as well. So one can actually create models which are even pliable. Of course, use of resins and ceramics is highest in head and neck, and I think all of you as head and neck surgeons do know the use of resins and ceramics. Polyacryl ether ketones, PEEK, polyether ether ketone, which is also PEEK, and high impact polystyrene sheets. These are all different materials which can be used, which have bone-like rigidity, and they are very good for recreating more stronger units, and can be used even for replacement of small bits of bones. Steel, titanium, aluminum, and metal alloys. I think titanium has been in use for a very long time, as well as steel, and especially so in head and neck surgery. Of course, bioprinting cannot be forgotten, and bioprinting definitely has a role, but that is something which is more futuristic when it comes to the discussions that we're having today. What would be the probable use of these? Let's understand. The FDM, or material extrusion, uses ABS, PEEK, PLA, polylactic acid, and various others like the ceramics as well as TPU. These are used primarily for making prototypes, used for surgical models, phantoms, applicators, implant medical devices. When we talk about material jetting or polyjet printing, this is, as I've told you, this is similar to an inkjet printing, where polymers are actually thrown onto the paper and they are created using the softwares to have a additive manufacturing that's created. And now the material that gets used here is ABS as well as acrylic clear resins. Now these require specific printers. They are used for creating surgical guides again, dental applications, simulation models, pre-surgical models, and trainer models. The third, that is photopolymerization, is the stereolithography and direct light processing. Here, resins are being used, and ceramics, again used for creating dentures, for creating surgical guides, crowns and bridges, and also used to create hard tissue repairs, especially the dental resins and ceramic resins. The powder bed fusion is primarily an expensive affair. It requires a certain material which is more of powder, which is brought together. Now, there are various methods by which it's brought together. There is selective laser melting, selective laser sintering, and electron beam melting. Of course, these create very strong units, and they can be used for bone replacements. They can be used for medical device manufacturing, processes, and surgical instruments as well. Getting into each of these, as I've said, polyjet printing or polymer printing, they can also be used to create various layers, and surgical models can be created. Now, of course, these droplets, when they are used, they are selectively jetted onto a built platform. And using the software, we create a complete model, and you can actually recreate the whole of the head and neck model, and that can be used for planning and technically for training of surgery. As far as the stereolithography is concerned, this is primarily used for dental prostheses and to create the dental molds. Direct light processing is a similar method. In the previous one, the stereolithography, what is used is an ultraviolet light. In direct light processing, the technique is similar, except that you're using a DLP projector as a source for curing the photoresins instead of the ultraviolet light. Powder bed fusion, I've already talked about it. Of course, there are various methods. Sintering primarily uses laser to get the powder together and create a very compressed layer by layer building up of the object. Laser melting or the SLM. Here a laser is used to provide heat and melt the powder together and compress it together. And electron beam melting, where it is an electron gun which does the same with the metal powders. Now obviously these are the strongest. They create these are the such as aluminum alloys, titanium, stainless steel, and these can be used to replace even bone. They give the maximum strength. Now the basic material extrusion is what we use for creating prototypes, and this is where we use fused filament fabrication. Various filaments can be used. The commonest of course is a PLA, and we use them for prototype making. Bioprinting obviously is still very much in research. It's additive manufacturing, where what we are using instead of ink is actually cells. So these are cells and biomaterials which are then laid down layer by layer to create an object or a tissue. This obviously is still a lot in research level, and whatever has been created so far is really in small nanograms, which are used basically for drug testing. As far as 3D printing in AgTech is concerned, I'm very proud to say that we did start this in a very basic form, in a very simple, modest lab in June 2018. The reason behind starting this whole lab was to print silicon. And one would say that that would be a crazy idea because there are no silicon printers available in the world. They are still in research stage. There are no printers available for outright purchase. So what we did was we tried to fabricate together a printer which could print silicon. And the reason was, obviously, I'm a breast surgeon, and what was the reason why we built that up was to print breast implants, and that's where the whole interest started. We began the lab with a fabricated FDM 3D printer with a very small footprint of 19 by 19 centimeters. You can well imagine that's smaller than a scale. So it's really a small printer. That's the printer that we had, and this is compatible with PLA, ABS, and TPU. We started off with the project of trying to print silicon, a tedious procedure, but we got funding from BIRAC, which helped us to build this up. The current status is that we are able to print small amounts of silicon, small sizes. So we are ready now to actually print processes like ear, nose, and of course small breast implants. So obviously these are very small ones. They're still in research, and there's a lot of work still to be done. What it did help us was to get an offshoot. We created breast onco-trainers, and we used this in an international conference in Goa in 2018 October to have oncoplasty being trained on these models. Now this was a mix of both 3D printing of the mold and getting the silicon cast into it as a mold cast. Obviously we have moved way ahead from there now. We are able to print the silicon. We should be able to print all of these onco-trainers as 3D printed models. COVID brought in a change. We used the same 3D printing lab to create face shields. Of course, this was just to let you know as to what all we have been able to evolve with the small 3D printing lab that we had in-house. We created nose clips. We even modified them to be used with eye loops, created microvascular small clips for the anatomy skill lab for cadaver workshops. And we used the same 3D printer to develop certain radiation delivery devices, assisted devices. So this is for the shoulder. We've had vaginal applicators, rectal applicators, and of course, even for head and neck, we had the head and neck support device that was created. And this is obviously a 3D printed mold where we used foam to create the actual headrest. Prostate brachytherapy applicators, cervical brachytherapy devices, Fletcher suit. We also created from the PACS and from the HIS, we got the images of CT and MRI, created skull models as well as the brain models, and these are for robotic training. But what is probably most interesting for all head and neck surgeons will be that we did end up in building our own image to print file for mandible. So we are now ready with the prototypes for mandibular resections. We can have an absolute planned cutting guide for the mandible as well as for the fibula, including the fibula table with the tray that we can use for putting together the fibula pieces. Obviously, this will shorten the procedure, which will make the whole procedure very simple. and we can have the reconstructed fibular graft for the post-mandibulectomy, allowing us to do much limited resections and even probably saving the ramus where we can. So including the dental guide for placing the dental implants at the same time that the reconstruction is being done. Now obviously this requires a lot of coordination with the head neck surgeons, the plastic surgeons, and as well as the 3D printing lab, and we are ready now to get this into clinical practice. In addition to this, we've also created the phantoms for dosimetry. This is a breast phantom which was created through images of the patient and made into the STL files. We then printed using thermoplastic polyurethanes or TPU. Using water as the interface, we created the dosimetry phantom. This has been now used to complete a thesis and dosimetry study of a student in radiation oncology. Obviously, this is now ready to be applied for various other parts of the body. We can create phantoms for head and neck. We can create phantoms for various other parts of the body. The zygomatic implants model has been designed again from images that is taken from the CT scans, printed making STL files, and now these are the images that were created for a zygomatic implant. Medical devices can be made, laryngoscopes have been printed, they have been tested out in our OTs. One case study that I would definitely like to share, there is the work that has been done with Dr. Sandeep Gurav in the dental and prosthetic surgery. This was the prosthetic management of a nasal defect in xeroderma pigmentosa. This 8-year-old child was born to a third-degree consanguineous married couple, had a growth on the nose since 3 months with pigmented skin, speech and language milestones were delayed, she had photophobia, and also had pigmented conjunctiva on either side of the limbus. The growth on the nose was obviously a squamous cell carcinoma, moderately differentiated squamous carcinoma, which was resected. And our job was not till here, but essentially to help in creating a nasal prosthesis. The child would not allow for the nasal mold to be taken. So we had used the images to create the nasal mold. The negative mold of the patient-specific nose was designed and 3D printed. Obviously, we used PLA to create these molds. It did require a slight bit of modification based on the child because the child was also growing. There were slight changes that was created, and based on these, the nasal prosthesis was then printed. So we did use a combination of mold casting as well as 3D printed mold and a mold casting with silicone. This is the clay impression that was done and final prosthesis. So you can see that the child eventually is now a happier child. The tumor has been resected and a nasal implant has been now made with silicone, mold casting of silicone with a 3D printed model. Keeping all of these in mind, we have now moved on to the next level. We have created our own next level indigenous 3D printer, which is a much larger footprint. This is a 60 by 45 by 35 centimeter printer that has been completely built in-house in Actrec. The beauty of this is this has a large build volume. It is a customizable and modular platform. We can modify it as per our need. It has an additional multiple material extrusion possibility. We can have 4 materials simultaneously being extruded under different controls. So 4 different colors. We can actually create a single model with all the 4 materials being used. It is compatible to various materials, PLA, ABS, PETG, TPU, and HIPS. It has Duet 3D electronics and completely Wi-Fi controlled. So we don't need to have it connected through a wire to a software. It's completely Wi-Fi controlled, and we can have even a distant control on the printing. This has been made in-house, and I'm very proud to say that we would be using these now to create larger numbers, larger prototypes, as well as modeling, and we will be using this in clinical practice. We still have a long way to go, but we would be using these now in close collaboration with the head and neck surgeons as well as the plastic surgeons to have the mandibular models to be created, as well as helping in the resections and reconstructions. Thank you very much for the opportunity to share our very small, short, brief experience that we've had, and we plan to be back again with much more to share in the due course. Thank you very much.
Thank you, Dr. Parmar. That was, I think you just just blew everyone away with with the phenomenal work that's being done at ACTREC today. So I think without the slightest doubt, I think the writing on the wall is very, very clear. The future of head and neck reconstruction definitely lies in digital technology and 3D printing. So just like to add on that, yes, definitely it makes surgery planning so very easy. Moving away from conventional eyeballing, it removes the guesswork in the operation theater, and I think it would make life virtual surgical planning definitely would make life so very easy for reconstructive surgeons and also for prosthodontists like me who would like to probably fast track, are constantly looking at fast tracking the process of rehabilitation. Today, 3D printing is going even beyond. It has a huge role to play in remote healthcare delivery. So we are involved in a project where we are looking at fabricating facial prosthesis even without seeing the patient. So we are looking at, in fact, I'm personally involved in this project where we are using the mobile phone as a scanning device already. And so that data from home and treatment in your neighborhood being our vision. So patients don't have to travel anywhere at all in future. And we've created these prototypes wherein you can have prosthesis absolutely without seeing the patient. So the patients don't have to travel. And I think that's where the future of technology is. Artificial intelligence and machine learning are going to change the way head and neck reconstruction is being practiced across the world. And I think I have always believed, and I think you've proven it as well now, that technology is not always expensive. It's a myth that technology is expensive and cannot be adopted. In fact, technology very often reduces the indirect costs of treatment that we don't really, we very often don't account for. So I think that's definitely the way forward, and I thank you for sharing a very, very futuristic presentation. In fact, the future is in the present already. So
yes, I completely agree there. So 3D printing has actually taken us leaps and bounds into the next level, and I guess having it in-house is even more an advantage, and that's very, very important for all institutes to probably look forward. Yeah, thank you very much.
Absolutely. Thank you.
Thank you, ma'am. Thank you, sir, for this excellent session. You and your entire team for this work you have been doing at 3D printing lab at TREC.
Thank you very much.
Yes, ma'am. Thank you.